Now let me ask you something.
Yeah.
What are the side effects of insulin? Because we all know that everything in this world there's always a side effect to something. So tell us.
I'm on the side of insulin. I'll defend it.
Okay.
I'll say insulin is not a drug.
So what is it?
It's a hormone.
Which is a drug.
Well, because it's being given exogenously, meaning from outside.
That's why
inside,
it's a drug.
It's a drug.
Exactly.
So, but baseline, it's a pharmaceutical compound that is still a hormone.
Daktari, ongea kizungu kidogo. Pharmaceutical compound ni nini?
So,
yes.
Walienda wakaunda hiyo molecule ikae kama ile insulin yenye inatoka kwa pancreas. Si hapo kila mtu ameshika.
Yeah.
I get so. I think so. So, being a hormone, insulin works to do some functions. So there are times, and the most common side effect of insulin is that sometimes we can give you this insulin and it causes the sugar to drop too much, too below. Unakumbuka akisema sijui between sijui what figure and what figure insulin glucose ibaki hapo katikati at a range that is normal for the body to function. So sometimes we can give you this insulin and it causes the glucose to go a bit lower than that level, which can be dangerous. Okay? So, and that is normal, it's expected, but it's not for all types of insulin. There are some insulins which can give you, which are more associated with hypoglycemia than others. And being automatic, those ones that really work fast on the food are the ones which are known to cause hypoglycemia more easily than the long-acting types of insulin. Okay, so that is a non-side effect. Patients are always educated on what to watch out for. There are numbers they are told if the insulin goes below this, or some symptoms that they are told, watch out for these symptoms. It can happen, okay? The other thing is, you can imagine, every day, Hilda, nikupikie tu hapa, kazi yangu tu nikukulisha. Kukulisha, what will happen? Sindio? So, if I'm giving you insulin, insulin is directing glucose to get into the cell.
Are you saying I'm fat? No.
No.
Okay,
no,
sorry.
No.
Okay, we can go back.
No. Okay. Anyway, but you look good.
Okay, thank you.
So, the whole point is, if I'm directing glucose into your cell, there's a lot of energy into your cells. And sometimes they can utilize some and store some. And when they start storing a lot of this energy, you become big. So part of the side effect is
weight gain.
You can
people.
Gain weight.
He's just not trying to be direct. You can gain weight from insulin.
Yes. So for people who want to get fat, come and see us. Well, we'll not do that. We'll not give you insulin.
That is true. And there's also this complication on the skin. What about the injections? You know, these people inject.
The injection technique is really critical. Okay? You know, those days when insulin was not really in its purest of forms, people used to get reactions when they inject insulin, because the body will be like, sasa ini nini umenidunga? Then it reacts. Then you start getting, reactions on the body. You get it. But now we've moved around and we've purified the insulin to become better. But still, on injection sites, multiple injections, especially along the same point, can make the fat there to harden.
Yeah.
So you find that some injection sites, it's hard on touch. Unaguza hivi unashanga, kwani kuna mawe hapa ndani? Okay? So it can happen. Okay? And that is the reason why there is a technique you're told of how to inject insulin, how to rotate on where you're injecting insulin, so that the chances of you getting what we call medically lipodystrophy doesn't really happen.
You know what? And we'll cover that in a subsequent video. We'll have a video showing how to inject and how to rotate the injections.
As in kujidunga.
Yeah. Thank you for that, Doc.
Yeah.
Now, let me ask you something. What is the most ridiculous thing you've had a patient tell you about insulin?
That the moment daktari akikuanzisha tu insulin, hauna miaka mingi ya kuishi. Ati hiyo sasa inamaanisha ugonjwa yako imefika end stage.
Yes.
Meaning, enda tu uandike will, uuze magari yako, utafute watoto wenye uliai wacha huko nje, Man, I'm not targeting you. but
it's true.
The whole point is they feel, especially type 2 diabetics,
Yes.
they feel that if you're starting them on insulin,
Things
they associate it with someone who was started on insulin and he died.
That's what I wanted to tell you. I have had so many patients tell me, Daktari, don't start me on insulin because so and so was doing very well until
they started
insulin
and
they died. So they think that insulin is death.
Yeah, which is not true. I mean, it's not true. It's just a drug. It's just how it's used, and the appropriateness and the setting and everything will be fine.
And I think the other thing that many people do not remember about diabetes is that everyone has their own diabetes story. Just the way we all have our own stories in life. My diabetes will not be like your diabetes.
Okay. Okay.
Okay.
Oh,
so my diabetes and his diabetes will be different. Maybe mine will end up with insulin. His might even reverse if he does. So just remember, let's not compare. Everyone should have their own journey, as long as it's a healthy journey, full of good exercise regime, and try to lose weight as much as possible. If someone is overweight, focus on that. Do not focus on what every other person is doing out there. You might be on insulin for now, but just focus on your journey right now. Don't look at someone else who's on oral medicine and start comparing.
So let me ask you the last question. Mzee, hii discussion imekuwa moto. Umefeel aje?
Imekuwa poa.
But ukunipea food. Ni uchoyo. But anyway, so imagine unakuja kwa nyumba ya dem alafu akupe. Anyway,
kuna food after this.
Now, there are patients who come to the clinic. You've been managing them on oral agents, meaning pills. So they have been taking pills. Their sugars have been behaving some type of way. Okay? Then you decide to change them to insulin. Why?
Well, we have targets. I like what you mentioned. So the diabetes is all about target setting. And actually I encourage all the people living with diabetes out there to know what their targets are. Targets meaning your sugar target, your lab test target. There's that lab test we usually do to check your sugars for the last 3 months. That is called HbA1c. It's a target. And also things like weight is a target. So there are some things that make us realize that we have to switch from orals to insulin. For example, if the sugars are consistently high above target, despite being on more than 2 agents, around 3 agents. If you're on 3 oral drugs, different drugs, and your sugars are very high, and you're on the maximum dose, usually we switch you to insulin. And that's important to note because out there, many people think metformin is everything. So someone is only on metformin until the end. So it's metformin plus other medications. Okay?
Yeah.
Now the other thing is if the person starts losing weight, because we have just said that insulin is all about kufanya padding nini ukae mzuri. So if we notice that someone with diabetes starts to lose weight unintentionally, that means that they don't have enough insulin in the system. And that's a sign that they need insulin. The other thing is now the 3 monthly test.
Yes.
So if it's been followed up well and the patient is on all the medications that they require to be on, but it's persistently above 10%, usually we start, even if it's just a 1 dose of insulin, because sometimes we give just a basal insulin on top of the orals. Sometimes we switch fully to insulin. So it depends on what your doctor decides. But that's another reason to put on insulin. So those are the most common reasons why we switch from orals to insulin. Yes. But apart from that, there's also things like development of side effect of some medication. Yeah, because sometimes you can get side effects of some of the orals that make us not able to continue with particular drugs, like maybe you have renal failure and there are many drugs that now we cannot give you orally. So now we switch you to insulin to save the kidneys from getting worse.
Or you become pregnant.
Then
Tongeje your story. Yes, so when you become pregnant,
we're not ready.
You can actually just be put on insulin. So stronger.
Daktari, we can't do oral medicine when we are pregnant.
We can.
We can. But and we can do.
But insulin is still the best in pregnancy.
It's true. It's true.
So hii discussion imeisha.
After pregnancy sasa umeharibu nini mood.
Okay.
Anything else?
Mpe food.
Well, Dr. Ombui, it has been such a pleasure having you on the show. You are always intriguing and engaging, and he's an awesome diabetes doctor as well. So tell us, where can people find you if they want to look for you?
Okay, I wanted to say something different, but well, officially you can find me at Davis Ombui on Twitter, DAVISOMBUI. Yeah, that's my handle.
For those who want to find him elsewhere, please, you can only go through me. I will let you know. Otherwise, you can also find me on my handles, Diabetes Doctor on YouTube, Diabetes Doctor KE on Facebook, and then Diabetes Doc_KE on Instagram and Twitter. Thank you and have a wonderful week ahead.
Stay sugar free.
Oh yeah.